Street vendors had arrived early, only to find their illegal market stalls shut down. They quickly turned their anger on the security forces brought in to send them home. They'd set up shop in defiance of emergency measures that banned public gatherings and imposed a curfew. The government says marketplaces like these are breeding grounds for cholera, and while it accepts the new rules are tough, it isn't backing down.
We find it extremely unacceptable that a small clique of individuals, of citizens, can decide to break the law when so many citizens have really been cooperative and have been helpful to the situation. We know that we are touching on people's livelihoods, but these matters we are talking about are matters of life and death. And every responsible government must make sure that people's lives are protected at all times.
The riot happened in Kanyama, a low-income township that is home to more than 350,000 people. It's one of two townships on the outskirts of the capital Lusaka where cholera broke out in late September. The disease quickly spread to the city and infected almost 3,000 people in about 3.5 months. Cholera is a bacterial disease usually spread through contaminated water. Left untreated, it can kill within hours. Last week, the government deployed the army to enforce a raft of new measures to try to contain the national health crisis. Specialist cholera treatment centres closed off to the healthy. An intensive cholera vaccination campaign and a ban on public gatherings that includes funerals, church services, schools, and marketplaces like this one in Lusaka. Just last week, street sellers here had pitched in to help the military close it off. Now they're opposing them. And as the impact on livelihoods grows, so too will the concern at the possibility of more civil unrest before the cholera crisis is contained. Mereana, Jazeera.